country, the whole world is in an uproar about COVID-19. And that has directly attacked one of our most valuable population, which is our seniors, and our seniors that reside in long-term care facilities. My name is Sonya Dunbar. I'm a dental hygienist, affectionately known as the Geriatric Toothfairy, and I'm here today to talk about and to demonstrate proper oral care for seniors in long-term care facilities. I'm making this video for the nursing homes that I provide care for. Also, for any other nursing home who would like to see this, for any assisted living facility, or any family member that's taking care of their loved ones at home. We have to send out this SOS to help save our seniors. Think about it. When you go to the doctor looks in your eyes, the ears, and the mouth. The mouth is the biggest part of the body that bacteria can enter. If your mouth is not healthy, your whole body is not healthy. So we have to help keep our seniors' mouth clean. Last year, more seniors went to the hospital in long-term care facilities for aspirated pneumonia, which is directly related to poor oral care in most cases. So come with me. Let me demonstrate how I recommend and how many dental professionals recommend that you keep residents' mouth clean in long-term care facilities. Now, there are other videos we have available that demonstrate denture cleaning and how to deal with the difficult patient or patient with dementia. But today, we're going to talk about proper brushing and flossing because we want to send out an SOS. We want to save our seniors from getting sick and even dying from bacteria that grow in the mouth. So come and go with me. I'm going to scrub up, mask up, and I'll see you on the other side. Good morning, Mr. Gecko.
Good morning.
Can I clean your teeth today?
Yes, you can.
Okay, we're all gloved up. You may have towels. I have a bib here. We always want to cover up their clothes just in case they spit or some stuff, toothpaste or things come out of their mouth. I already have my table laid out. So I'm going to grab my mouth mate, which I really like because it helps keep the mouth open and allow me to be able to see, have more access to the area. Take my toothbrush and my toothpaste. You do not need a large amount of toothpaste, especially if someone may have gag issues or if they have swallowing issues. You do not need a large amount of toothpaste. So I have my two products here, my mouth mate, which I'll bend so I can easily get into his mouth. Will you open up for me, Mr. Gecko? Thank you. So I gotta have the mouth open. I have access, I can see. And I'm gonna open up and see, I can see clearly in there. I'm going to angle my brush at a 45-degree angle and go in short circular strokes. Now, when I'm doing that, I'm sweeping plaque and debris and bacteria off of the teeth and under the gum line. Then you move to the front, short circular strokes here in the front, angling at the 45-degree angle, so you're sweeping bacteria from under the gums. And then you go to this side. Then you're going to come on the inside, 45-degree angle. You got here, cleaning the back of the teeth. And the 45-degree angle over here as well. Removing all the plaque and debris. Then I sweep along the bottom. Same thing for the bottom of the mouth. Opening up, I have great access, great visibility. I can see if there's food or any debris trapped in the back of their mouth. Because sometimes people pack food in their mouth. 45-degree angle, short circular strokes. As long as the resident will allow you to. It's recommended 2 minutes. Move around to the front and you hit down here. I like because I can see. I'm also pushing the bristles in between the teeth, doing additional cleaning. 45-degree angle over here. I'm hitting every surface of his mouth. Inside, 45-degree angle. Straight up and down right here. Cleaning all the plaque and debris out. Also, I'm looking in his mouth for sores and injuries as well. Sweeping it around. Now we have our tongue cleaner here after we brush all the surfaces. A lot of the residents have medication on their tongue. So I take the tongue cleaner, because their medicines are crushed, and I scrape the debris and plaque off their tongue. Removing that from his tongue, and his breath is more fresh. You can rinse out now, Mr. Gecko. I have the basin here so he can spit in the basin. Do you want to rinse some more? All right, we're done. Now, flossing is just as important as brushing. Whether you use the string floss or the picks, you have to remove the bacteria from in between the teeth. Food, debris, bacteria, plaque gets trapped in between the teeth. Now, I choose to use the floss picks, and they look like little Christmas trees. They come in different sizes. I like these because they keep my fingers out of the mouth. And you just take them and go in between each and every single tooth that the resident will allow you to. Lower and the upper, going in between each tooth, changing the pick between the intervals. So you may have to use maybe 3 or 4 of these and wipe them off in between, going in between the teeth. So you can use the floss picks, or you can use the floss string, whichever one works better for you. But flossing is just as important as brushing. We have to help keep our residents' mouth clean and fresh. Mr. Gecko, how does your mouth feel today?
Feels good.
Great. Thank you for allowing us to demonstrate today. We want to help keep our residents strong and healthy and free of diseases that grow in your mouth. Thank you, the Geriatric Tooth Fairy. I want to start off by talking about a few of the products that we recommend that can be used inside of a long-term care facility. First thing I want to talk about, if a resident is independent and they can take care of their own teeth, we want to encourage them to do that. Sometimes you may need additional aids. So I want to introduce these 2 things. If someone has dexterity problems, I like both of these because these have better grip to hold and better reach. So both of these are good. They're good products to use, and they can be cleaned and disinfected daily after use. And residents like using these things because it helps them keep their own independence. The other thing that I like is the mouth mate. And you'll see me demonstrate this when we begin to do oral care. Also, tongue cleaners are excellent things to use to help remove the bacteria, debris, the food off of the tongue. Also, a denture brush. I love these, and I'll talk about it more a little later. Last, a toothbrush. Now, again, we have 2 choices as to how you want to floss teeth. We have dental floss or floss picks. And also, we always want to keep your toothbrush covered up. And this is a toothbrush cover, and you can just snap it over the toothbrush. Also, you never ever use toothpaste on a denture. You have to use some sort of denture cleaner. So I recommend that you use, I like this product because it has a lot of natural ingredients in it. It's Dr. B, Clean-A-Dent. I love this because dentures have to be cleaned daily. I will talk about that a little later. You need a bib to cover the patient. If you don't have a bib, a towel will work. You need your cup, your basin, and your mouthwash. Always your gloves and your mask. And I always recommend eye protection when you're doing oral care, especially with droplets that could be in the air if a resident begins to cough. You want to cover up all of your open area. Last but not least, this is one of my secret weapons. This is a roll I call cheapy toothbrushes, because if someone has an infection, if they have COVID-19, or if they have aspirated pneumonia, or even a regular cold or flu, you want to change the toothbrush daily, because if you're using the same toothbrush, you're reinfecting them. So if you get this, I think I paid $1 or $2 for this whole roll, every day reusing a different toothbrush. I remember when my husband and I, we had the flu. We had it for several weeks about a year ago. And my husband woke up one morning and he said, "Sweetie, we're using the same toothbrush." And it just made sense. As soon as we started throwing away our toothbrushes daily, we got our cold cleared up, and we were a lot better off. So we recommend that you change the brush daily if that is at all possible. You can clean it, but a lot of bacteria can harbor in these bristles, unlike plastic.